Again, good morning, and thanks very much for being so hospitable. It's a pleasure to speak with you. Um, let me start with a story to sort of illustrate the kind of phenomenon that domestic violence fatality review is. A number of years ago now, many years ago, I went to my ophthalmologist surgeon to have some eye surgery, and I walked into the waiting room. It was early morning in Flagstaff. It was the winter. It was cold, and it was like 10 to 8, and I just had a cup of coffee. And I walked in, and the waiting room was full, and this rather aggressive nurse comes up to me, and she grabs me on the shoulder, and she takes a marker pen, and she puts a cross above my right eye, without saying anything to me. And I like aggressive women at times, don't get me wrong, but this was a little bit beyond the pale, I thought, and I said to her, "Excuse me, ma'am, what are you doing?" And she said, "Well, you want them to operate on the correct eye, don't you?" And I said, "Well, I'd like that. I'd prefer that if they did." And she said, "Well, that's what we're doing. We're putting a cross above the eye so that they can see, the surgeon can see which eye to operate on." So I accepted this, and I must have given off the impression that I wasn't entirely happy with this. I had some concerns about the safety. And she said, "Well, you've read the research literature on this, haven't you?" And I said, "Well, I've read some stuff because I do domestic violence work, fatality review work and safety." She said, "Well, you want to go away and read some of the stuff in the Atlantic on airline crashes and particularly on accidents in medicine." She said, "It's amazing how many people are operated on inappropriately in this country every year." And this woman, I slowly engaged her, which was my mistake. And she said to me, "Well, there are more deaths through mistaken surgeries and problems in surgeries than there are motor vehicle accidents and homicides combined." I said, "Well, thank you for sharing, ma'am." She said, "Now go over there and sit down with the rest, and we'll get you in when the surgeon's ready." So I went and sat down, and I thought about this, and I came into the surgery room eventually, and it was like a warehouse. We live in the United States, not in Canada here, so the medical care is a little different. It's highly commodified. It's rather like a conveyor belt. So I walked in, and there were like 20 people in a row on gurneys, all with crosses above one eye or the other. So I talked to the surgeon who I knew, and I said to him, "Excuse me, but this is rather interesting." He said, "Yes, we've had problems. We've operated on the wrong eyes before now." And this was a simple remedy, the cross above the eye, that they had learned to do in ophthalmic surgery to prevent mistaken surgeries. It was rather like a seatbelt in a car. And what we found through exploring errors in fields of medicine, aviation, nuclear fuels, is that we can correct problems fairly easily if we're open to reviewing tragedies and accidents with a keen, detailed analysis. And the purpose of domestic violence fatality review really is just that. If we look at the airline industry is much, much safer now than it was 30 years ago. I still don't like to fly, especially not to places as far as Yellowknife. But the truth is, the airline industry has cleaned its act up enormously by investigating crashes in a way that doesn't blame and shame individuals, in a way that gets at what went wrong, and in a way that recognizes that planes crash due to multiple factors, sometimes involving human error, sometimes involving mechanical problems, but whatever they involve, ultimately, there is usually a multitude of factors that go into those deaths. And that too is what we find in domestic violence killings. And if you look at cockpit crews these days, and you look at the airline industry, when they review a crash, they review everyone, from the person who sold the ticket right the way through to the captain who flies the plane, to the stewardess, etc., etc. So it's a very elaborate review process. And we find cohesion and shared values in cockpit crews at a much higher level than we find in the medical profession, for example. If you survey captains in cockpits these days, 95% plus are going to tell you that they're comfortable with being challenged by junior members of the cockpit or other people in terms of decision making around safety. When you ask surgeons the same question, that 95% comes down to about 50%. And when you ask anesthesiologists and surgical nurses, that comes down to between 33 and 25%. So the level of cohesion around what we should do to ensure safety differs by profession. The airline industry, nuclear fuels are well ahead of medicine and other sectors. So we learned a lot from this. We also learned a lot from Chernobyl in 1986 when we did the research into Chernobyl and what went wrong. What we found prior to 1986 was a history of cover-ups, was a failure on the part of the Soviet government to actually publicize accidents and to learn from them and to learn from those mistakes. So philosophically, when we approached fatality review work in the field of domestic violence, we took on board these philosophies from these other sectors. We just didn't come to this, willy-nilly or at random. We came to this through the lens of prevention and through the lens of not blaming and shaming, but through the lens of accountability. So I want to start by saying that because in domestic violence cases, the idea with fatality review and other multi-agency interventions is to create a culture of safety. And a culture of safety that works for victims, that works for their families, and that also holds perpetrators accountable and works for perpetrators as well. It's very important that we don't create a punitive blaming culture for two reasons. One is that we know it's ineffective. So if we start blaming and shaming individuals or agencies at the table, we're not going to get the information that we need over a period of 10 or 20 years doing this work. The second reason is that we know from our research that those people who abuse and tyrannize their intimate partners often use blaming and shaming tactics themselves. So we don't want to perpetuate that style of operating and behaving. So the reason we don't have blaming and shaming philosophies and punitive philosophies in fatality review is that they really don't work. They're not healthy, they're not wholesome. So having said that, do you guys have any thoughts or concerns about that? Any questions? You're okay?
Everyone looks good nodding their heads.
Okay.
Keen.
Okay, let me go on then. So you've already seen this in the Montana film, but I want to define what domestic violence fatality review is, very formally. And it really is a process for identifying the homicides and suicides and indeed other deaths that are caused by, related to, or somehow traceable to domestic violence. And that definition we found over the years, the team of consultants that works with me and myself and many others have found that that definition is really helpful. And we've deliberately chosen those words because they work for us. They encourage a very wide-angle lens approach to the number of deaths that are caused by domestic violence. Caused by domestic violence obviously could mean that someone dies in an immediate intimate partner violence situation where typically he kills her, sometimes she kills him. Where the death is obvious, the cause is obvious, a gunshot wound or a knifing or something, some blunt force injury, but these are obvious. But related to is less obvious. The woman who commits suicide because she is at her wit's end and knows no other way to exit the relationship. It is clearly related to domestic violence, but it isn't necessarily directly caused by domestic violence. We've had cases where depressed, battered women have been given guns by abusers while they're intoxicated with the words, "Go ahead, if you want to off yourself, do it." And they've done it. Now that clearly is related to, traceable to, might involve a case, for example, of a battered woman who contracts HIV. Now this is very difficult for us to clearly identify that connection between the two. Now if you go to the HIV clinics in Atlanta, Georgia, where the CDC is based, and you look at the notes of the workers who do research on women who die of HIV, and many of those women are marginalized women, African American women. If you look at their medical files or their notes, what you'll see is often histories of domestic violence and battering in their relationships. Now we know that HIV infections are more likely to be passed on in battering relationships than they are in non-battering relationships. We know that battered women are at much higher risk of contracting HIV infections for a whole host of reasons. Their batterers are perhaps less likely to want to use condoms as a control issue in sex. They are more likely to have frequent partners and to engage in promiscuity outside of the relationship. They are more likely to have spent jail or prison time where the HIV infection rates are much, much higher. They're more likely to force anal sex. They're more likely, for example, to have used IV drugs. All of those factors in those cases predispose that abuser and the victim to contracting HIV. And if HIV/AIDS ends up being the cause of death, there are groups in the United States, the Philadelphia Death Review Team was the first to do this, that have explored or traced the death caused, the presenting reason being HIV/AIDS, to the violence in the relationship. Now that's an extreme example of that tracing it to, but that definition is important because as we set out to do this work, we need to have really a broad understanding of the kinds of deaths that are caused by, related to, or somehow traceable to DV. So we can return to this in a second. So the idea is first, in this definition, to identify those deaths. And that, of course, might entail a broad initiative aimed at counting and tracking aggregate data. And that could occur through a public health entity. It could occur through a newspaper clipping initiative, through a coalition, a domestic violence coalition. There are lots of ways that you can count aggregate data. So identification of deaths. The second aspect of the definition involves the meticulous analysis of those cases. So the analysis of the case is important, and let me just lay out what that analysis process involves, just very briefly. There are really 5 parts to a fatality review, 5 components to a review. The first is the building of what we call the timeline, sort of a chronological timeline that in the film you saw done using pieces of paper on a wall that could be moved around, which is a very effective way of doing a timeline. The various markers in the case laid out over time, perhaps going back to the birth of the perpetrator and even the birth of the victim if you want to, whatever the group deems to be appropriate. But the timeline is constructed in a way to convey a longitudinal sense of the case in time. And the conveying of the longitudinal sense is really important, because one of the huge problems we have dealing with domestic violence cases is that systems respond to those cases through the logic of the system itself, i.e., they respond in an incident-driven way to perhaps effect a prosecution or to decide not to prosecute, whatever the case may be. But they are focused on the elements of the statutory requirements that are met in the case or not met in order to proceed. What we find is that although that's obviously the nature of the system, the way it works, we really want to imbue or instill in systems players across the board a sense of the longitudinal aspects of the case. In other words, what came before? Because instilling that longitudinal consciousness is a better way of getting a sense of risk and danger. Because whether we like it or not in these cases, we're moving towards a place where we have to triage more carefully. The fiscal austerity that we're faced with these days is forcing us to look more carefully at how we do these cases. Is it really necessary for us to make arrests in cases where people slap each other once every 6 months on a Friday night? Is it something that requires someone to be incarcerated if blood is drawn and probable cause is met? So we try to convey a sense of danger in cases in systems players through this timeline construction. The timeline is not something that is, festooned with facts. I mean, it's not got facts laid all. It's something that just generally conveys the sense of development of the case towards the homicide. And when we do this, we usually see a clustering of risk markers and various other things prior to the killing, which you can't typically see when you're working the case in real time. Now, you can do a timeline on a wall, as Matt Dale did in the film, or you can do a timeline with color coding using Excel spreadsheets. This looks like a very nice facility that you're sitting in there, and maybe you can put some computer terminals up and some screens up and sort by date using Excel. There are lots of ways of doing this that are tech savvy. So that really is to be determined. But the process, the timeline is the first element of that process. And it's a team process. And I've noticed the Canadians, the Ontarians, have taken to using the word committee or board sometimes to describe fatality review teams. I just be upfront about my preference here. I prefer the word team because it implies an interaction and a togetherness amongst the group, rather than a committee, which is something almost to be gotten through. At least that's my experience of committees sometimes. So the timeline is a collective process. It builds camaraderie in the team. It's not something that one person does and says, this is what I've got, do you like it, is there anything to add? If you do it that way, you miss the team building aspect to this, which is incredibly important, because as you're building the team with multi-agency players, you're building not only the team and the analysis of the case, you're building relationships between different governmental entities and indeed community members. So the construction of the timeline as a collective process is a really important aspect of the case. The second aspect of the case, or the element of the review, is what I call red flag analysis, or analysis of the markers, the risk markers that we use in our communities that the researchers tell us are valuable in these cases. And we now have a very elaborate research literature on risk in domestic violence cases. What we find, it's really interesting, regionally across the United States, when we do this, we find that there are real clear connections between the fatality review work that gets done in these states, their risk analysis work, and their coordinated community responses. There's a little triangle there that we have to think about as we move into this work. And I know that working through the Ministry of Justice, you'll be thinking about these things. But fatality review is really a way of enlivening really stimulating coordinated community response work. And it is also a way of really fine-tuning our risk assessment work. One of the biggest problems we have with our risk assessment work, I think this is true globally, is that we've focused a lot of attention on the risk markers themselves. And you all know what they are. I mean, you know, we can go through the prior history of domestic violence, you know, evidenced by things like attempted strangulation, forced sex, weapons use, etc., separation or pending separation in the relationship, obsessive possessiveness, morbid jealousy, depression, suicidal ideations, all these different things that abusers evidence in their relationships, we can pick those up. We have a good sense of what they are, and we add probably one every 2 or 3 years. But what we haven't focused on, and what Fatality Review can do for us, is the how. How do we do risk assessment with victims and with perpetrators in a way that gets us the information? Because I can't tell you how many homicides I've reviewed over the last 15 years I've been doing this work, where there was evidence of risk in the case that the families, for example, knew about that the system didn't access. And our analysis of red flags in Fatality Review is not just about listing flags. It's about asking the question, what did we know about the level of risk? And how come we didn't know about that? How come there were things in this case that we didn't have access to? Because the real goal of good Fatality Review work is not to assess what the victim's behavior was necessarily, or how we thought she could have accessed services. It's really about accessing the mindset of victims and perpetrators as they move through the maze of services that we offer them at great expense. So the idea with the risk analysis in these domestic homicide reviews is to get at victims' own perceptions of risk. Why was it that the victim recanted? Why was it that the victim took out an order of protection and then went back to the court and asked to have it rescinded? It's not because she's stupid. It's not because she wants to get killed. What we often hear is, it's because she didn't think the system could protect her adequately. And we have to get at that information. It's at the heart of the issue of risk in domestics. Her perception of the risks posed not only by the perpetrator, but by her involvement in the system itself. And that requires a flip in our logic. The how we do the risk, I would suggest, is at least as important as the questions that we ask. And when I do risk assessment with victims, when I do victim interviews, I often find that I can get the information about the danger that victim is in by not actually going to a questioning mode. In other words, through having a conversation and a dialogue, I can create, or other people can create, a sense of rapport and trust where information about danger will be spilled without ever asking information about, has he strangled you? Has he pointed a gun at you in the past? That stuff will tend to come out with rapport building. So the analysis of risk in these cases is not just about what were the risk markers, let's check the box if they were present. That may be necessary. You may decide to do that as a team, territory-wide. But the analysis is more, I think, complex than that. How did the victim perceive risks? What did they mean to her? What was the context within which the risks were going down? So that the risk analysis is the second part. Look, we know that the alcohol variable is a very important risk marker. If you look at Jacqueline Campbell's research that was published in 2003 in the American Journal of Public Health, what Jackie found was that when she compared a group of 343 women who were battered but still alive with a group of women who were murdered, 220 women who were murdered, this was an 11-city study, what Campbell and her co-researchers found was that the women who were murdered were 4.1 times more likely to be involved in a relationship with an abuser who was in the habit of becoming drunk on a daily or near daily basis. In other words, alcohol consumption on the part of the perpetrator is a huge problem. And of course, alcohol consumption really is evidence of other things in relationships. Alcohol consumption also compounds depression, as we all know. So if you do a little bit of it, it may be a social lubricant, but you do too much, it's going to depress you. So we see a link between that and suicidal ideations and depression that speak to the level of disenchantment in the relationship that I think fuel perpetrator and victim shame. And I think that we have to see alcohol as a signal or a sign of other pathologies in the relationship that lie much deeper. I would also say that if we suggest that one of the ways of intervening here is a 12-stepping Alcoholics Anonymous intervention that uses the language of codependency, then we really end up potentially identifying victims as enablers and being codependent. And you subtly, I think, or maybe not so subtly, end up blaming her or implicating her in the perpetration of the violence that's directed at her. So the treatment modalities for alcohol intervention, typically the standard ones anyway, do not comport easily with intervening in domestic violence cases where we demand that the perpetrator be held accountable. Not necessarily treated punitively. I mean, we can deal with perpetrators a lot of different ways, but there's a dissonance or a disconnect there between the two. But I would suggest always that when we find alcohol use in these cases, and we find it a lot, that we dig well beneath the alcohol, because it's not the alcohol. The alcohol is a sign, it's a symptom of what's going on elsewhere. So let me go on to the third element of the review process, and that is what I call the level of agency and community involvement in the specific case. And you know, we can start off by doing this fairly easily by noting when we bring all the papers together, and you saw this in the Montana film, they collect the data that they can collect statutorily under the confidentiality statute, and they just analyze that so they can note fairly easily which agencies were involved. In the last 5 years, particularly in the United States, and this has really been a fairly momentous movement in the US and elsewhere, and in the UK as well, we've taken to involving family and community members in fatality reviews, which has been a phenomenally informative development. So that the other part of that piece is just the agency involvement and the community involvement. So who knew what, and when did they know it? And then the big question in the third section of the review is not just which agencies and community members were involved or knew about the case, but what was the degree of communication, coordination, and collaboration in and between those different entities. And that's a key question. And regardless of the amount of agency involvement that we find, regardless of the number of people in the community who knew, and we have tremendous variation there in those things. We have really two sets of cases. We have a very large set, probably the majority, where there is minimal systems involvement, if any. And we see extreme isolation on the part of victims, and indeed extreme emotional isolation on the part of perpetrators as well. And those are, I think, the majority of cases, certainly that I've come across in the US. But we find other cases where there is significant systems involvement. But in both sets of cases, with both sets of groups, if you like, we find minimal collaboration between agencies, coordination, or communication with the community, between the community and the agencies. And this raises a huge question for us that's a very problematic question for us in terms of the delivery of state services. We offer these state services at enormous expense to the public, the taxpayer. If you look at the costs involved in processing these cases, they're enormous. And it really requires us, when we find this information out, to ask the question, why is it that there was so little communication and collaboration between all these different entities in these cases. And this is one of the things that Fatality Review can do, is to address that gap. It is a huge question. And I'll return to this later when I talk about combining fatality reviews with safety audits. But clearly, that third section of the review is critically important. The fourth section is what I call developing recommendations that are implementable, thoughtful recommendations. This is the fourth component of the review. Now, this is a tricky one, because after you've sat very enthusiastically and you've reviewed a case at great length, you uncover all these problems or gaps potentially. And you think, my goodness, after 10 or 12 or 15 smart people sit around a table for a day or two, they think, oh my God, there are 20 things that I want to do in the territory or in the community or the region to put some of this stuff right. And that's laudable, but it's not politically savvy. What we have to do is to develop a set of recommendations that we think have a very good chance of being implemented. One, for our own long-term sanity, in that we don't want to put 20 out there and only see 2 implemented. But second reason is a very important one, is that if you put 20 recommendations out there, particularly in the United States, and 5 years later, only 4 of them have been implemented, it doesn't take a very smart civil litigant to come along and say, my client died in this community in a domestic violence killing because this expert panel that made 20 very wise recommendations was not able to effect or introduce 16 out of those 20. In other words, the recommendations that you leave hanging that you don't implement leave you vulnerable. So that conversation is really a political conversation. You know, let's take the recommendations that we have a chance of getting through. So this requires us to think strategically in the long term. Matt Dale talks about this nicely in Montana, and I can't remember if he uses this language in the film, but he talks about workhorses and show horses. By workhorses, he means the people who bring the documents in and do the review. The reviewers who pore through case file after case file and then come up with a set of recommendations, the workhorses. The show horses are the ones who maybe occupy higher political positions, who can effect change. And there are teams that have set up a 2-tiered organization. The Miami group is one example. When they first set up their initiative, they had the mayor, the chief of police sitting on an executive committee, the show horse committee, with the workhorse committee feeding them potential recommendations. So again, that's a thoughtful structure around recommendations or social action items. And those are the fourth part of the review. The fifth part of the review, which I think in some ways is less important, but nevertheless it's valuable, is that there are going to be, as you go through the review, unanswered questions. There are going to be things that you need more information on. And the local community review team here in Northern Arizona, where I live and work, that review team will sometimes take 4 or 5, 6 months to review a case, with a number of meetings over that period of time. And as they uncover questions, they will send various members of review teams out to answer those questions in the respective systems. So unanswered questions is a good fifth category to keep in your back pocket as you go through the review process. So that's the process of review. And that really forms an important part of the definition. The final part, so identification, the process of review, and the final part is what I call just the prevention piece. The prevention piece is key. We do this not because we just want to understand the deaths, although teams did certainly start out with that modus operandi. We want to understand what happened. But the idea is to prevent. And those two obviously go together. You'll see when Kelly Watt talks on the Canadian film about this separation between understanding and prevention, but quite frankly, they've never been separated. Teams have always tried to do prevention work, it's just more difficult. But the prevention piece at the end, the fatality review work is taken and seen in the light of other coordinated community response work, risk work, and other work we do. So one needs a sort of 30,000-foot aerial view on this stuff in terms of developing preventive interventions. I think that's a very good question. It's a very difficult one to answer. I would just say subjectively, looking at it from traveling to these communities regularly, which I do, I would say absolutely yes. And I think what we've seen is a growing recognition of the complexity of the cases and the difficulties different systems players have working these cases, and the good-heartedness that most people, whether they're cops or advocates or whatever, bring to the table. So I think there's been a softening of the punitive side of this, and actually, dare I say it, a greater understanding of the plight of victims and perpetrators for that matter. I've seen a softening and a humanizing approach to perpetrators as well in some of these communities. But, you know, I think with that stated philosophy up front, we're not here to blame and shame. If you want to blame someone, you could, I guess, blame the perpetrator who pulled the trigger, but ultimately, the complexity is what, you know, trumps everything else, I think. That's again a great question. I'm well aware of the coroner's service, the prominence of the coroner's service in Canada in terms of doing this work. I think in the United States, there's so much variety. Coming here from England, you know, I'm English originally, and England is centrally governed, and you clearly have some elements of that English governmental philosophy in Canada as well. But in the United States, local government reigns in many different ways. And we see a sort of a pastiche or a mix of state-run fatality review initiatives and county-based fatality review initiatives. Some of those state initiatives are housed in public health facilities. For example, if you look at the state of Virginia, which has a very elaborate network of fatality review teams, that initiative as a state initiative is housed under the auspices of the Department of Health, which would be in some ways comparable to the coroner service in that it has a public health ethos. And that's correct. I mean, I would say in 95% of cases in the United States, the cases are closed, and they are closed to the place not only where the coroner or the medical examiner has issued a report, but to the point where if there's a criminal prosecution pending, that prosecution has been effected and the perpetrator is incarcerated without any complex appellate issues pending. Yes, and there's a concern here with the timing, obviously. But there's also a concern with where is this housed? These reviews are different if they're housed and run or co-run by, say, for example, a police department or a law enforcement agency. And there are, when fatality reviews started in Arizona, where I live, we had enormous support from the police. And the police, in fact, have been the driving force behind doing reviews. If you look at the state of Hawaii, one of the earliest states in the United States to do a fatality review, those reviews started in-house in the courtrooms by one of the judges there. He had in-house reviews, and then it sort of radiated out to criminal justice reviews, and then it slowly became a community process. But who houses the review? Who's the lead on the review? I would strongly suggest that you have a mentality or a mechanism for rotating that, potentially. Either rotating it institutionally, you don't necessarily have to house it with a coroner, although you might want to. You might want to have co-chairs as the lead on the teams. But if you try to prescribe this process, in other words, if you develop a very, very detailed set of terms of reference that prescribe the process down to the nth degree, you may be very comfortable as you get going in terms of your process. We've covered all possible eventualities. You know, we've prescribed how the review will proceed. But for me, that's putting the cart before the horse. You have to develop a flexible language that enables you to roll with the punches in these very, very complex cases. You're not going to be able to foresee some of the developments that you'll find. And that's part of the excitement, the stimulation of the work. But you can't, if you enshrine that in some bureaucratic document that says you can only do certain things, you will miss a lot of opportunities. And that's my concern with the language of terms of reference that are overly rigid. So I really think that's important at the front end to have a conversation about that. You're at this cusp of thinking about, well, we might move forward or we might reject this process, but flexibility is key. I was actually going to go into, if you're okay with this, just to summarize the kinds of deaths that review teams have reviewed to give you a broad sense of where you might go. Because different case types yield different systems compromises. And clearly the information that we get depends upon the case type that we review. And what we learn about our system depends upon the case type that we review. So if we only review intimate partner homicides, we're going to miss a lot about the systems that we need to know. So what I want to do is to just go through a few case types that kind of illustrate the kinds of things that we find in these cases. And so let's start by saying that the staple case to review, especially when people start, and especially when they don't have a statute, is a homicide-suicide. Because the homicide-suicide case is clean, if I can put it in delicately. It's clean in the sense that there's no one surviving. It's clean in the sense that there are no pending, typically, criminal or civil issues in those cases. You have to check that, obviously. But, you're not going to get sued. You're not going to interfere with the prosecution. Where there are pluses, there are sometimes minuses as well. And I think the litigious mentality in the US also makes people pay attention to certain things that they might not otherwise pay attention to. So it swings and roundabouts, as my dad used to say on these issues. It's kind of complicated. But the intimate partner homicide cases are obviously eminently takeable without a suicide. And I would strongly encourage you to review cases where both men and women kill. When we first started in the US, there was a lot of political resistance to reviewing cases where women killed, for lots and lots of reasons that we won't necessarily have time to go into today. But we've managed to change that and encourage jurisdictions to involve cases where women kill. Usually, as we all know, when women kill, they're either exercising self-defense in their own minds, they're defending their children, or they're engaging in a preemptive strike. They may not be acting in accordance with some of the retreat rules that are required under the criminal law. They may still be culpable in court, but that's usually the way it goes when women kill, but it's not always the case. I'm defending 2 women at the moment who are facing the death penalty who have killed under circumstances where it could easily be construed that they were primary aggressors or predominant aggressors in those relationships. So these are complicated cases, and don't shy away from those, because it will affect your credibility as an entity if you are just seen as working one side of this issue. Fatality Review, I think, has succeeded because it has appealed to a broad political base, both in the United States and elsewhere. So it's important, I think, to have an open mind about these cases in terms of the intimate partner homicides. The familicide cases, we found an increase in these, the killing of the whole family, in the United States over the last few years that have attended the recession. In both the homicide-suicide cases and the familicide cases, we tend to see that offenders are better off financially. They are more likely to have come to the attention of public health or mental health professionals rather than criminal justice professionals. This is especially the case in homicide-suicides, where there is no prior history of domestic violence that the system knew about. We often see depression, suicidal ideations, suicidal attempts as key prominent themes in combination with cocktails of medications in those cases. And in the familicide cases, foreclosures on mortgages, pending bankruptcies, these are loss of a job. These are very important issues that raise questions for us in terms of how we do our work. So the multiple killings open up different avenues of inquiry about how do we treat suicidal thoughts, how do we treat depression, how do we do crosstabs with that and histories of DV, how do we do emergency screenings in hospitals. I mean, these things are linked, and those different case types open up different phenomena there to review. The next broad category of cases are what I call family killings. Brother kills brother, mother kills father, father kills children, child kills parents. All of these cases often involve an adult context of domestic violence. You know, in the United States, we have this child death review movement, and in fact, it's a global movement now, and it came out of the sort of medical scientific literature that developed in the 1950s. You know, the concerns of radiologists and pediatric radiologists to look at child injuries and child deaths, and to identify the cause of death. Now, when we do child death review in the United States, we tend to treat that as being separate from adult domestic violence fatality review. And children's cases are shielded by the confidentiality laws in the field of medicine in the United States. Their deaths and the information in those deaths that come to the table are shielded and protected in a way that the information is not allowable to go forward in adult death review cases. So there's a dissonance between the two sets of cases. But when we look closely at child deaths from abuse and neglect, what we often find is an adult context of domestic violence, adult domestic violence. So you look at, for example, SIDS deaths, very controversial diagnosis, sudden infant death syndrome deaths. You look at the research on SIDS deaths. If you look at the research, you look at David Southall's original pioneering work that was published in the journal Pediatrics back in 1997, and what you see there is conflictual family life that is consistent with adult domestic violence. The SIDS deaths sometimes have a co-occurring phenomenon of domestic violence. You look at the postpartum psychosis deaths, similar kinds of things. You look at Munchausen by proxy deaths. There is often a context of adult domestic violence. My point is that if you go down this path, you need to think about links between your child death review initiative and adult death reviews, because the disconnect between protecting children and protecting battered adults, the disconnect between those service delivery systems is huge. The child protective services people are charged with protecting the child at all costs. The adult advocate for battered woman is charged with protecting the battered woman at all costs. And the disconnect between the two is phenomenal. And adult and child death reviews are ways of bridging those gaps and bringing those folks to appreciate the complexities and difficulties. We found ways, too, of allowing supposedly siloed private information to flow through these reviews. There are ways of doing that. It requires smart lawyering, quite frankly, but it is important. And this is something that's just come up recently in the state that I work in with regard to the counseling, social worker, and psychologists community and their duty to warn. We are finding that psychologists are reluctant to testify or to participate in fatality reviews because they say their own licensing bodies would be concerned about them divulging information about client confidentiality or confidential client information that would besmirch the profession. The reviewers, on the other hand, are saying, well, if you don't come forward, it may look as though you're covering up in certain cases where indeed there was a duty to warn because a victim or indeed a perpetrator shared information with you confidentially that in fact met the standard of a duty to warn that you then did not follow through on. So these are very complex issues, and again, there's no one answer to them, but certainly we wrestle with these all the time. But you're absolutely right that we can finesse this and work around this. There are ways of doing this. So it's not all hopeless in that regard. That in the US, and this may not be true for you, but in the US, protecting a new boyfriend from an abusive old boyfriend has for at least a decade, if not longer, been the subject of potential civil litigation. Law enforcement agencies and advocacy units develop safety plans to protect battered women, or male victims sometimes. But foreseeing that another man may be at risk from a previous boyfriend raises different systems questions that are interesting. And we've had some teams review what we call sexual competitor killings for that very reason. It talks about safety planning, stalking the stalker programs in law enforcement that raise interesting questions. The whole topic of suicides we've already talked about a little bit, but again, I think the evidence is very strongly suggestive on this one. I would guess that we lose more women a year in domestic violence relationships to suicide than we do to homicide. Certainly in the United States, that's true. The research that we have in the United States, and this is the research of Evan Stark and Anne Flitcraft that was published originally in 1995, is that if you look at women who present at hospital emergency rooms for suicide attempts, anywhere from a quarter to a third to 40% of them, somewhere in that region, 25 to 40% of them, have injuries that are consistent with domestic violence battering that they receive on the day that they attempt suicide. Now, it's very hard, obviously, to piece these things together, but the research is strongly suggestive that fatality review teams ought be reviewing the suicides of battered women because of the possible links. And again, this raises different and interesting systems questions. These are public health questions. And where teams have done this, where teams have done that analysis, where they've run the crosstabs, it's not difficult to do. Woman dies of suicide, you just explore whether or not there was prior police calls to the residence for DV, affidavits, written request of an order, existing orders of protection, etc., etc., etc. You just run those and see what the connection is. And where teams have done that, they've found links. And that might be something that, as an initiative, you might want to do from the front end, to track that and to see what the links are. Because exploring the role of DV in suicidality as a public health phenomenon would take you well beyond just depression and beyond alcohol consumption. It would take you beyond necessarily the phenomenon of childhood sexual abuse, which obviously predisposes towards mental health issues in adulthood. And it would take you to other more pressing issues of violence in the relationship. So teams have found those very useful, and a number of US teams are reviewing suicide. And there's this whole area of indirect deaths, that I call indirect deaths, that a whole bunch of teams have reviewed. Accidental deaths, disappearances, suspicious deaths, things like car accidents, drownings. Deaths of homeless women. In the United States, homeless women in the last generation or so have comprised the single biggest change in the homeless population in the United States. In the US, what we found with the official federal data in the US is that nearly 3/5 of homeless women are put on the street by domestic violence. That's the official figure. Published by Joan Zorza in 1991 in the journal Clearinghouse Review, which I'm happy to share with you. If you look at the mayoral data from the cities in the US, that figure of 59% comes down to about 20 to 30%. It's still a high number. We lose a woman in a year in Flagstaff, Arizona, who'll crawl in a dumpster maybe and have a few beers. And we have 100 inches of snow a year here sometimes, and she'll crawl in the dumpster to get protection from the wind, and she'll die of hypothermia. Hypothermia may be the presenting reason that the coroner or the medical examiner in our case would put on the death certificate. But the reason she was put there was the violence in her relationship. Some groups have taken to reviewing these indirect deaths. So drug addiction deaths, the deaths of sex workers or prostitutes, the deaths we've already talked about, HIV deaths, all these are deaths that a smart death review initiative might like to consider in its work. The short answer to that is no, definitely not. Child death reviews have this sort of scientific ethos in the United States. They're pretty cursory, they're pretty fast, they typically don't involve the family members. They're looking more at cause of death, immediate cause of death. And with a teen death, unless there was a death review that somehow obviously involved the teen themselves, either as a victim or a perpetrator of DV, then you would not see, I think, that extensive analysis. But I think it would be very important to do. Strikes me as very valuable to do. Now, another development in the US in some states is the reviewing, and this isn't really fatality reviewing, but it's phenomenally useful, and that is the reviewing of near deaths, where we still have the victim. And a number of states in the US, and Arizona is one of them, have passed amendments to their fatality review statutes to incorporate the review of near deaths. And a near death will be defined, and don't quote me on this, I'm no attorney, but the near death generally gets defined in terms of the person would have died if there wasn't immediate and urgent medical intervention. So let me give you an example. We reviewed a case in Milwaukee, Wisconsin, a number of years ago, where a woman had been protected by an order of protection, but she went back, she invited her husband, who she was separating from, back to her house for coffee to discuss the terms of the divorce. And it was a very amicable conversation. They sat out on the back porch, they talked about it for an hour or two. She was a very, very smart woman. She spoke numerous languages, she was very eloquent. But at the end of the conversation, she certainly decided that the divorce would proceed. And the gentleman, and I use the word loosely, opened his cell phone and pulled a razor blade out. And he cut her from ear to ear. And she bled out onto the street. He then took the razor blade and cut his arms lengthwise, and he himself started to bleed out onto the street. And I'm sorry to be so graphic, I don't mean to disturb you, but sitting next door on his porch, up until that point enjoying a cup of coffee, was her next door neighbor, who just happened to be an EMT, or emergency medical technician. And he ran into the street and he saved both their lives calling an ambulance. So they lived to tell the story. We are still working on getting a perpetrator interview with him. He's serving 20 years for attempted murder. She lived to tell the story, and we conducted an incredibly long and detailed interview with her. But to cut a long story short, she told us things that we could not obviously recreate from the file of a dead victim. The near-death reviews are enormously powerful and enormously emotionally challenging for us to do. But they are cases that, because we have the victim alive, if she's willing to converse with us, that we can really learn a lot about strategies and systems. Let's begin towards wrapping this up. A couple more case types, and then I think we can maybe take a little bit of a break. Another important case type, I think, to look at is bystander deaths. A number of other people die in these cases, be they police officers, be they co-workers, be they other family members or neighbors, other people get killed. And there was a movement in the state of Vermont, actually, which has been doing death review for a number of years now, to actually have a separate conference on bystander deaths because they were so important. And they were so important for political reasons as well as just it was the right thing to do. Getting police officer buy-in to how important domestic violence is, one way of doing that is to review the deaths or injuries of police officers in these cases, or court personnel. So bystander deaths is another thing you might like to think about. You might reject it, but at least to have it on your radar as you move forward. And then finally, and this is more a question on my part, but I live in the state of Arizona, which has some very controversial immigration laws. I'm sure you've perhaps heard about those, but do you have issues with immigration and migrant battered women? We have several hundred people a year die on the Arizona border crossing from Mexico into Arizona, and we lose probably a number of battered women in those cases. And I just wanted to raise that as a possibility, but it sounds like that's not something that's an issue for you. Another possible issue is honor killings. Do you have any honor killings in the territory? Some teams have found those good to review. I wanted to say a few words now about the geographic spread of domestic violence fatality review. And I say this because it surprised me, the spread. When we first started doing this work, really in the mid-1990s in the United States, I was working for the governor's office in Florida at the time. We were trying to understand, make sense of domestic homicide. But I wrote some grants to the federal government here to set up fatality review in the state of Florida. It was a systematic statewide initiative. And teams came on board, 3 teams came on board, then another 5 came on board in Florida. And nowadays there are, I think, 20 teams in Florida. But at that time, in the mid-90s, there were only 2 or 3 U.S. states who'd done the occasional fatality review. So when the federal government actually approached a group of us and said, well, should we do this nationally? I was keen to do that, but I said, there's a lot of resistance to doing this. And the resistance really at the time came from law enforcement and to a much lesser extent the courts. And I think this was a stage in the development of domestic violence work where police were, I think, rather defensive, sometimes for good reason because of some of the errors that had been committed, and they were sensitive to the civil litigation stuff as well. So it made sense. But since then, we've come an enormous way, and nowadays there are about 43 to 45 US states that have some semblance of domestic violence fatality review. And some of these developments have been really extensive. I mean, if you look at states like California, Florida, even the relatively small state of Maryland or Virginia, these are states that have anywhere from 10, 15 to California, 25 teams in their state. I mean, this is a remarkable development in a relatively short period of time. Even in Arizona, where we set this initiative up just a few years ago, we now have 10 teams and 2 teams in the offing. So, and I'm really perplexed to understand why that is, because many of these teams have arisen without any funding base at all. And the only thing that I'm left to conclude from this, and this is, I think, purely accidental, it's one of those things that happens, is that people have found the process really useful. I think that's one part of this. In terms of uncovering systems difficulties and challenges, people have found the process useful. I think the other element of this is that people have found also that the work is fascinating. And I don't mean that in a sort of prurient or pornographic sense, although indeed it may appeal to those interests as well. Some of the case material is really pretty dreadful in some ways. But I think there's an element of case analysis that is deeply fascinating. law enforcement officers are used to dealing with the blood and guts of these cases. But, and as are victim advocates, as are other people, emergency medical folks, but when you piece that stuff together, you get a multi-agency sense of the case that is really unprecedented in its depth and complexity. And I think that that is something we've seen with the rise of these teams. And the teams that have survived the longest are the teams, there's no question about this one, the teams that survive the longest are the teams that do the most detailed work, that involve and reach out to community members and to surviving family members. So the reviews that take the longest, the reviews that are the most complex, the reviews that are the most emotionally draining, are simultaneously the reviews that are the most valuable and also the most threatening, especially to systems players. So there's kind of like an irony to this. The more we're willing to push the envelope in the direction of being threatening, the more we're willing to allow our systems to be exposed, the more benefit we get. So good fatality review, make no mistake about it, is not for the faint-hearted, and it's a very uncomfortable process sometimes. And to me, that's always been a strange irony. But when you look at the teams that have survived, I mean, I went up to Montana and trained that team in, I think it was 2001, in the wake of that Mosier familicide. Or maybe it was 2000, I can't remember. But nevertheless, if you look at that team, the survival of that team, those people on that team stay on that team. They know each other, they're cohesive, some of them even socialize together. And it's a pretty powerful way of setting things up. So part of the spread of fatality review, I think, has been that people have found it fascinating and valuable for their systems interactions. But part of it is, I think, part of a broader trend, and you'll know this being connected with the Ministry of Justice. The last 30 years in terms of criminal justice service delivery within states, modernized, westernized states, we've seen the rise of multi-agency solutions to social problems in general, not just domestic violence or even crime. We've seen the rise of phenomenon such as risk assessment. I mean, that whole idea of risk and prediction goes hand in hand with this idea of triaging services, of being fiscally austere to deliver state services that work. And I think when you situate fatality review, both historically and geographically, it fits in with this idea of the frugal deployment of state services, the thoughtful deployment of state services. And I think fatality review, in its work with domestic violence cases, also holds the potential to inform this discussion of triaging. You know, we can't keep up this level of incarceration and treatment intervention that we've developed. And we've developed it for good reason, because people weren't paying attention to the problem. But I think in many ways people are now saying that we've overcompensated, that we have so many people going through the system and suffering because they've gone through the system, where those cases aren't necessarily life-threatening. They're more about relationship difficulties, they're more about economic problems, housing problems, etc., than they are about inherent tyrannical domestic violence. So the history and the spread has also been about interdisciplinary solutions to problems. And I think, again, we see this with the development of the teams. So in moving forward in this way, the fatality review process is consistent with, I think, other developments in the modern state apparatus. You know, certainly, I mean, I think culturally, when we started to take decisions to make arrests in these cases, we took a very important step symbolically and culturally in saying this behavior is inappropriate, it's wrong, and it was a huge step and a very valuable step. Helped us come a long way in making a statement about this behavior. But we didn't do a good job, I think, at the time, and still don't, about what this behavior actually means. If this behavior actually means, you know, a slap on a Friday night, as I said earlier, where you accidentally draw blood, you clip someone with your nail, the police turn up and they've got perhaps probable cause to make an arrest and they do so, is that really the most effective way to handle that problem versus the person who's been tyrannized longitudinally, historically in their relationship for a long period of time, and you get the same cut and the same presenting evidence at a scene, obviously in the latter, the arrest is more appropriate than it is in the former in some ways. So, you know, I think these questions, fatality review and other coordinated responses, can begin to perhaps contribute to. I want to now shift gear and talk about membership of teams. And this is a huge problem. You saw this discussed in the Montana film, or at least introduced in the Montana film. And I want to spend a little bit of time on this. First of all, I know you've got, Rebecca, obviously you've got access to our website where we discuss issues of membership. But just a few general words on this, because we're in the process of updating our website. You know, it took us a long time and a lot of mistakes to realize that victims of domestic violence and perpetrators of domestic violence share their stories with people they're closer to than with systems players. And this is obvious. Even a researcher could tell you this. But it took us a long time to learn this on the ground. And in Montana, the researcher Christine Fiore did, and this isn't mentioned in the Montana film, but Christine did a series of interviews with about 400 battered women over a space of about 10 years. And what Christine found is that battered women are much more likely to share their stories of abuse with their pastors or clergy than ever they are with law enforcement. Much more. They're also much more likely to share their stories with law enforcement than they are with a victim advocate in residential in-service treatment or some kind of intervention. This was very instructive for us because with the Montana Initiative, when we first set that up, you know, there clearly was a law enforcement officer on the team. There was a victim advocate. They're very important members of teams. But we had not put a member of the clergy on the team. So the key to good fatality review is recreating the case through the eyes of the victim and through the eyes of the perpetrator as they lived their various predicaments. And that really is our guiding principle. And this speaks to the issue of understanding service delivery. And you'll see me restate this on Peter Jaffe's film that he's got. Our task in doing this work is to understand how victims understood the array of services that we offered. Not for us to understand our own offerings to them. And there's a huge difference between those two. We may see a logical array of tax-supported services, of privately funded services or whatever, that are laid out for victims to choose from. What victims see when we do interviews with them, especially in near-death cases, is a maze, is an alienating maze of services. So the issue for us is to construct teams that are representative enough so that we can get at, in a wide-angle lens way, what it is that victims perceived was being offered to them. So teams need to be inclusive. They need to be creatively constructed. And we've got to think outside the box and be open to having new members on teams and to bringing people on. You believe in accessing the voices of women. If they're telling you this is important to them, then we should have these folks, shouldn't we? It was a contested arena for a while. Same with other stuff. If the school counselor is going to hear about the abuse before the criminal justice system does, and this is sometimes the way, we need representatives from the schools to be on fatality review teams. That's important for us. These are people that are key players. So the question here is, we work out from the life of the woman in particular, the victim. Who was influential in her life? And we bring them, if we can, to the table as permanent members of teams. Well, thank you, and I've really enjoyed talking with you, and I'm more than happy to do this again if you guys need that. So feel free to call me again.